Good afternoon, class. Myself, Mr. Sunil Awate, and I am the professor and HOD, Department of Mental Health Nursing from Patil College of Nursing. So today we are here to see a topic which comes under organic brain syndrome. The topic name is dementia. So let us see about the dementia in detail. So to introduce the topic, before going to the dementia, I would like to tell you that is what is organic brain syndrome. So organic brain syndrome, here the person will be having different psychological problems due to the damage to the structure of the brain, and these damage to the structure of the brain occurs due to the causes which are due to the inside factors and due to the factors which are outside of the brain. And these are the only disorders in the psychiatry where you can see there will be the damage to the structure of the brain, and the rest of other disorder only there will be the changes in some neurochemical changes in the brain. So here these organic brain disorders, here we have a global syndromes which are delirium and dementia, and we have specific syndromes like amnestic disorder, organic mood disorder, organic delusional state, and organic personality disorder. So here in this class we are going to see about the main thing, that is about the dementia. So here dementia. So let us see the definition which is given in the book, and the definition goes like this. It is an acquired, generalized, and usually progressive impairment of cognitive functions, that is memory, intelligence, recall, orientation, language, and abstract thinking. So here what does it mean? So here it is an acquired. Acquired means which is gained throughout our life stage, which is gained throughout our life, that is what it is acquired. Generalized means the whole area of the brain will be affected, or all the functions of our mental abilities are going to affect by this, and usually progressive impairment of cognitive function. So once this disorder happens, here there will be the progression of the disorder. Here the person cannot be become a normal. It is a slow, there will be the progression of this disorder, and of mainly the cognitive functions like memory. The main thing is the memory. Whenever we think of dementia, there will be the disturbance in, the first thing is about the memory, and along with the memory, even the intelligence, recalling abilities, orientation, language, and the abstract thinking are going to be deteriorated. So these are the things which are going to be deteriorated in dementia. But the thing is that the person's level of consciousness, the person will be fully conscious here. All these changes can occur in the person, but the person will be fully conscious. This is what it makes a difference between the delirium and the dementia. In delirium also you can find the similar changes in all these areas, but the person will be unconscious stages, but in this dementia the person will be fully conscious. So this is what the basic difference between dementia and delirium is about. Then the epidemiology. Epidemiology says that this dementia occurs predominantly in the elderly people. So it is said that this disorder is a disorder of old age people. And here the prevalence increases with the age. And here the statistical analysis says that 15% who are about 65 years of age, and the 20% who are about 80 and 85 years of age. So this is what here we can see, that the person who is about 80 years and above, they commonly used to get this dementia, and if it occurs below 60 or 65, it is called as a pre-senile dementia. So this is all about the epidemiology, and then moving ahead, the risk factors. So the risk factor, the common risk factors, there are several risk factors. Among that, the first and the foremost important one is aging. Aging is the most common risk factor for this dementia, and here you can see the person who is about 80 years of age, they used to get this dementia. And the second thing is being female. So commonly the dementia is the ratio shows that it is commonly seen in the females. Then the family history, as most of the psychiatric disorders, they do run in the families. So here the family history is another risk factor with some defective genes, like the genes like the defective chromosomes, like chromosome number 1, 14, 21. So these are the defective chromosomes which we can see in the dementic patients, which is supported by the literature. And the hypothetical risk factor, that is aluminum toxicity. Aluminum toxicity can be seen in the person's brain. Aluminum traces can be found out in the person's brain. Okay, and then the next one is having history of a head injury. Head injury can be a risk factor. Then moving to the next one is low educational status. Dementia is usually can be seen in the people who are not that much educated. And smoking is also a risk factor for dementia, and even the dementia is associated with the Down syndrome. So these the literature even suggests that the Down syndrome is also a risk factor for the dementia. So these are some of the risk factor, and the most important risk factor here what we wanted to see is the aging. That is about 80 years of age. Coming to the etiological factors, what are the causes of having dementia? So dementia is, we can categorize these causes into two headings, that are reversible causes and irreversible causes. Reversible causes and irreversible causes, most of the causes are irreversible type. Okay, here irreversible type. Here the first thing is about the degenerative disorders. Degenerative disorder of central nervous system. Like here we can see the Alzheimer's disease, Parkinson's disease, Lewy body dementia, Tick's disease. So these are the degenerative disorder of central nervous system, where you can see there will be the death of the neurons, leading to all these central nervous system disorder. So all these are the irreversible. All these are the irreversible causes of dementia. Irreversible causes of dementia. Then we have the reversible causes also. Here the reversible causes are like the psychiatric disorder. In psychiatric disorder, some psychiatric disorder you can find dementia-like symptoms, like pseudo-dementia of depression. Some of the depressive patients, they used to forget the things. There will be the impairment of memory. That is maybe because of depression, but it looks like it is because they are losing the memory or forgetting the things. It looks like similar to the dementia. That is pseudo-dementia of depression. Then we have cognitive decline in the late life of schizophrenic patients. Okay, late life of schizophrenic patient. The person who is suffering from schizophrenia years together, in his later life, the person will be having decline in his cognitive functions. Okay, and which is similar to the dementia symptoms. Then we have here is like vascular causes. Vascular causes, here we have multi-inflat dementia, which is common among Indian patients. And next one is like demyelinating cause, that is multiple sclerosis, and we have metabolic causes also. Like in metabolic we have vitamin deficiencies, mainly the vitamin B12 deficiency, that is even we call it as thiamine deficiency, and even endocrine disorders like hypothyroidism. So because of these metabolic disorders also, these are also one of the causes of having this dementia. Okay, then coming to the next one is about the infections. Infections also may cause dementia, and here we have different infections like meningitis, encephalitis, AIDS can also cause dementia. Then we have drugs and toxins. Drugs and toxins in this taking heavy bout of alcohol. The person takes heavy bout of alcohol, heavy metal poisoning like lead, mercury, arsenic poisoning and all. Then exposure to the harmful radiations, barbiturate poisoning, like these barbiturates are the sedatives and hypnotics. If the person they take, like sleeping pills and all, the person is taking too much, and carbon monoxide exposure. All these are the drugs and the toxins which can also cause dementia. And in miscellaneous causes, you can see like other causes like stroke, heat stroke, trauma, tumor, and epilepsy. All these are the miscellaneous causes of dementia. Okay, all these. So these are all the causes of dementia. And as I said you earlier, like these can be categorized like irreversible and reversible causes. Mostly the first one here, degenerative disorder of central nervous system, are all irreversible causes, and the rest of all are the reversible causes. We can reverse it back to some extent. But the thing what we have to notice is most of the causes are the irreversible type. Then coming to the types of dementia. Okay, what are the types of dementia? So clinically there are 4 types of dementia, and let us see one by one what these are. The first one is Alzheimer's dementia. Alzheimer's dementia here, it is one of the commonest type of dementia, and which accounts about 70% of all cases of dementia. Okay, so that is why it is considered as most commonest type and more commonly in women. As I said you in the risk factors, the being woman is also one of the risk factors. So it is commonly seen in the woman. Then if you do the autopsy of the structure of the brain, and here you can see some of the changes like enlarged ventricle, widened sulci, then shrinkage of the cerebrum, senile plaques can be seen in the person brain. Okay, so these like widened sulci, gyri is the bulge part, and between two bulge part there is a sulci, and here the sulci is normally widened. Okay, and along with this shrinkage of the cerebrum is commonly seen in the person, and senile plaques can be found out in the person's brain. Okay, and then another thing is about the decreased acetylcholine level in the brain of the person. Okay, acetylcholine, it is a neurotransmitter which is responsible for all psychomotor activities. We call it as psychomotor activities, bodily activities. This acetylcholine level is somewhat decreased in the dementic patient. That is why you can see the person like doing the activities in a very slow motion. Okay, so this is what, and this is one of the irreversible type of dementia. So Alzheimer's dementia is a permanent as well as it is a irreversible type of dementia. Once it is occurred, we cannot reverse the condition back. Then coming to the second one is multi-inflat dementia. Multi-inflat dementia, it is, as I said, it is the second commonest type, and which accounts for 10 to 15% of the total dementia. Okay, 10 to 15%, and here it is mostly seen in Indian patients. Indian patients, they suffer from this multi-inflat dementia, and here the causes for such a dementia is the cardiovascular disorders. Cardiovascular disorders, like for example, is like hypertension and all. Okay, so these are the common causes for the multi-inflat dementia, and this is mostly a reversible type of dementia. We can reverse the condition, of course, if we give a proper treatment to the root cause. If we treat the cardiovascular diseases, we can reverse it back to some extent. Okay, this is about the multi-inflat dementia, and the next one is hypothyroid dementia. It is a third type of dementia, which is called as hypothyroid dementia, and it accounts only about 1% of total dementia. 1% of total dementia. Okay, and very rarely we can see these type of dementia, and the cause itself is hypothyroidism. As the name indicates, the cause is hypothyroidism, and this is also a reversible type of dementia. We can reverse the condition very well if the thing is that the treatment we have to start within the 2 year of onset of the disease condition. Within the 2 year of onset of the disease condition, or being diagnosed as a hypothyroidism, if we start it within the 2 years of duration, we can reverse this condition. So this is about the hypothyroid dementia. Then moving further, the next one is AIDS dementia complex. AIDS dementia complex, this is the last type, clinical type of dementia, AIDS ADC. Here it accounts 50 to 70%. 50 to 70% of the people who are suffering from AIDS will have AIDS dementia complex. AIDS dementia complex, and here you can find the deficits in the subcortical region of the brain, region of the brain, and here the virus which is responsible, the cause is like the virus which is responsible for having AIDS, HIV or AIDS, that is the lentivirus, is the cause of such a dementia, and here we can diagnose it. As you know, there are different methods like ELISA and Western blot method to find out about this type of dementia. Okay, so these are the 4 clinical types of dementia, and among these, the most common type of dementia is the Alzheimer's dementia. Coming to the stages of dementia. So the dementia itself is categorized under 3 headings. The first stage, earlier stage, middle stage, and the last stage. The earlier stage, let us see about this earlier stage, which lasts about 2 to 4 years. And here, as this is the earlier stage, the person starts this disorder with usually the forgetfulness. Okay, forgetfulness is the first thing what you can notice in the person. Usually, you know, we used to forget the things, and you know, we might have seen like our grandparents and all, they used to forget the thing. They used to keep their specs here and there, and they used to forget and all. So like that, it usually starts. We used to keep the mobile and we used to forget. So like that, it starts with such a forgetfulness. Okay, so simple things the person starts to forget, but that is okay. As normal people also used to forget, but the thing is about the frequency. When there is a frequency, when the frequency of forgetfulness increases, there the problem arises. The person forgets the important things also. He starts forgetting the important things also, whatever he is doing. So that is the problem where it begins, and it begins with the forgetfulness. And now the person is slightly aware that he is forgetting the things. Now he is having that awareness also. Then because of this, what happens is the decline in the interest in environment. Okay, the person loses interest in the environment because of his forgetfulness, because might be he got frustrated because of that forgetfulness. And then the next thing is about the hesitation. The person will hesitate to do some action. He will not at all ready to do some action. If you will tell the person to do some activities, he will not be able to do so because of this hesitancy of forgetfulness. Whether he will be completing that task or not, that hesitancy will be there in the person. So that is why he won't do he won't take up the task itself. And the next one is the poor performance at work. Because of this hesitancy, not taking up the task or not completing the task, the person is very poor at his work. Okay, whatever work is being assigned, he will not be able to do so. So this is what the early stage is all about, and which lasts for 2 to 4 years. Okay, then after that the person jumps or moves forward to the middle stage, which lasts about 2 to 12 years, and here the person will be having the progressive memory loss. So here the memory loss will be continued. As I said, this is a progressive one. Here there will be the progression of the memory loss. So here memory loss will be there as the part of the brain will be affected, and those changes can be seen in the person. And here another thing is hesitate to respond to the questions also. The person will hesitate to respond to the question. In the previous stage, he hesitates to initiate the action. Means he was understanding what he has to do. He can understand it. But here the person is even not able to understand the question also. Okay, he will not able to understand the questions also. Okay, so that is why he will not be able to give response to those questions, and difficulty in following the simple instructions. The person has the language area is also affected here. The person will no more be capable of understanding the instructions. Okay, so that thing is also gone here, and because of all these things, the person become very irritable and anxious. The person will become very irritable and anxious because the things are not going as per his wish. So that is what. And in middle stage, one of the important things what we wanted to see is about the wandering tendency. Wandering tendency is the person will get lost in the familiar setting, and like commonly seen in a dementic patient. Suppose they are sitting in a room, and if they go outside, and then the person will not be able to come back to their home because of this forgetfulness. He may forget his address, he may forget his way coming back to the home and all. That is what it is called as a wandering tendency. And then no personal hygiene because of all these forgetfulness and all, and the decline in the interest in environment, the person will not be able to take care of self he will not be interested in doing the activities of daily living independently. So we can see lack of personal hygiene, and then we have social isolation. Because of all these and awareness of his mental incapabilities, the person will try to isolate himself from others, because he don't want others to let they know that about his